Welcome to CDI Virtual PN Open House. I am Santoshi Karbri. I'm the Admission Assistant Director of Admissions, and we have a guest speaker today, and we will go over all the details. Okay. Now we will go over today why you should choose CDI College. What is so popular about the programs and why you should choose CDI. And also I will go over a few things about our services that we offer at CDI College, like how we offer the program, our instructors will go over all that details as well. Okay. And also we will go over what as a job, practical nurses, what their job is, like what their duty is, what they have to do in the field. So we will go over all that details. And I will welcome our guest speaker, Crystal Gounder. She is our LPN Supervisor, Wellspring Infusion Clinic and NAS Pharmacy. She's an employer, plus she is our CDI College graduate as well. Okay, and then after that, in the end, then we'll open the floor for the question and answers. Okay. Now, why choose CDI College? CDI College, first of all, we are for a 50 years old college, and also we are offer this program from the long, like we've been offering this practical nursing from a long time, and also do a lot of hands-on training. All our program is designed such that we have our own clinic. We have our own clinic, and then they do lots of clinical portion while they are doing before they go out on a practicum. And also our program is in person. It's not online. There's only few module that you will be doing online, third-party certification, but you are in the campus. So you still will be coming. So you'll be learning more by more hands-on rather than online. Mm-hmm. And also what we do is we offer, if we had our first semester, and each semester you're going out on a practicum. But before going out on a practicum, you're doing hands-on training in the clinic and class before you go out on a practicum. We place those students for practicum. Each semester you're learning and you're going out on a practicum. And so you will be having hands-on training as well. We have our instructors, the clinical instructors, on-ground instructors, they all are highly qualified. They are working in the field. So you'll be getting a live experience on the floor as well while you're going through the courses. The best part is there's no wait list. Like we offer this program 4 times a year. If you meet the requirement, then there will be, at least you can start sooner and you'll be at workforce sooner. You don't have to wait for the wait list and not working in the field. And also the classes are really small size class. The maximum students we can take is anywhere from 25 to 28 students in each cohort. So you will have the opportunity to talk to the instructors one-to-one in case if you have any questions, concern. Our coordinators are there. So they are there to help you out as well. And then you'll be graduating sooner. The sooner you graduate, the sooner you will be able to be working in the field. So if you have any question, I will give my information here on the chat. You can email me or you can call me, text me, email me, and then I can give you more details about the nursing program. Okay. Now at CDI College, the programs that we offer as well as the services we offer is that we have a student services team. Student services team, their job is to do the scheduling, making sure that you can log in properly. If you have an issue about logging in, about books or anything, the student services is right there to help you out, to assist you. And or if you're having any concern, anything, they are right there too. And we also have our employment specialists, like a career services teams. Their job is to assist you with, once you complete, you want to know where to apply, how to apply. So we will help you with resume, cover letter, where to look for a job, how to look for a job, We assist you with job placement. We do mock interviews. So basically, we walk you through the door. Then, of course, you have to go for your interview. But majority of the time, the students are really get hired at the time of the practicum as well. We have our financial team here as well. Our financial advisor will guide you, help you with how to apply for student loan or other kind of funding like RRSP funding, payment plan funding. So basically at CDI College, what we do is we hold your hand from day you walk in till you graduate. So we walk you through the door till you graduate. And also our educational support, like our PN coordinators are here. If you have any issue, they will help you, they will assist you, they'll guide you. If there's any issue or anything, they'll sit down with you. And also the other thing is also at CDI College, when you're in school, you will be called by your name, not by your number. So it's like more hands-on one-to-one classes, that small classes that we offer here at CDI College. I will welcome Faith to explain you about the nurse's duty, nurse's job. She is our regional director of nursing, and she has been in the field for many, many, many years, and she has lots and lots of experience in the field. So she'll go over all the job duty of as what the nurses do. Okay, welcome, Faye.
Thank you, and good afternoon to everyone, and thank you for joining us, putting this time to listen to what we have to offer. So, what is a practical nurse? What do they do? So, they provide nursing services with defined scope of practice to patients based on the assessment and care planning procedures. They perform interventions from simple to complex procedures, meaning from hand washing to vital signs to aseptic techniques, sterile dressing, infection control, and they provide preoperative and postoperative personal and comfort care. They establish respiratory therapy or they monitor established respiratory therapy and IV therapy. They monitor progress of patients. They evaluate and document effectiveness of their nursing, and they collaborate with the different members of the healthcare team. They also provide safety and health education to individuals and their families. So I just want to say that CDI is the second private college who has offered the PN program in BC. Why do I know that? Because I was part of the team who actually pushed for the private colleges to offer the PN program. It used to be just public college, and we follow the same provincial program just like others. It's highly regulated by the legislation of nursing legislation of BC and the British Columbia Nursing Association. And the mandate is public safety and client-centered care and ethical care. Next, please. Santosh, next slide. Okay, so why is it more important to be an in-person learning? We had in a pandemic, we had a really bad experience with that because nobody can come to class, so everything was online. And we have noticed that the decrease in learning from our students, their marks have gone down, and everybody is so confused as to when it comes to some of the clinical experiences or clinical say hand washing or dressing. It's hard to just watch in the video, so there's no actual hands-on. So the advantages is that the instructor offers real-time insights to the students to help them understand while gaining the ability to receive instant feedback on the quality of their instruction and to prove upon themselves. So they can actually discuss if there's a question right there and then that the instructor can discuss it with them. It's highly interactive, provides space for instructors to interact with students and to improve class success rate. So we had to really work on that success rate right after pandemic because everybody has to come back to class. Ideas and opinions are also promptly shared with the fellow learners, and they create that bond within themselves. I have some students or graduates, just like Crystal, who are still connected It's like their second family. When I do orientation, I said, welcome to your second home when they come to CDI, because it's going to be their home for about 18 months. IT support is always available in all campuses 24/7. And like I said, when they were doing online, there's so many distractions that they had at home. It could be their family, little kids playing around. So there's less focus when they were doing online learning. Next, please. So other benefits that we offer, we provide accommodation, provided that we have some medical documentation, and they still have to meet the requisite skills and abilities set by the College of Nurses. Tutorials are always available. Sometimes there's also some distractions in class that the students sometimes miss some of the points during lecture in theory. So they have the ability, or they can actually go to their PN coordinator and say, can you clarify this module or this discussion that we had? And on the hands-on too, we have open labs, just in case you're not secured about going into the skill testing. They can have an open lab and practice with an instructor before their final skill testing. Next. Program breakdown. I was saying 18 months. So to complete the program is 75 weeks. It is delivered 4 semesters, and each one is built on the previous to foster emergence of new knowledge. And they consolidate at the end of each semester through the clinical practice. It's called the spiraling curriculum. So they build from the simple to the complex, but they bring all of those knowledge every semester. One thing good about this program is that because of the 4 semester, on the second semester, if they successfully complete the second semester, they can actually apply to the to the HCA registry, BC Carried registry, to get a registry number, and they can work as an HCA part-time while going to school. And all those courses, that was the theoretical courses that you can see on your screen is pharmacology, professional communication variations, and the practice courses are the integrated nursing practices that the lab before they go to consolidated practice. Yesterday, I just got an email from one of the biggest agencies, nursing agencies, saying that they want to affiliate with us because they want to take our students. And most often than not, our students are being hired even before they graduate in their final practice. Next, please. So here's one of the testimony of one of our students who has graduated from us, and I'm sure Crystal will agree. There is that ability to connect with the instructors, and then the instructors are always available. So we have a PN coordinator and instructor for every module. So if there's any problems at all, whether it's equipment or they didn't understand what was discussed, the instructors are always ready to help. And Santosh already said it's small classes, great schedule, and the great schedule, and it's given on time so they can plan ahead. And that's it. Thank you very much.
I will welcome Crystal Gounder, one of our graduates, as well as working in the field, and plus she's an employer as well. So welcome, Crystal, to our open house.
Thank you so much. So I will give a little background of who I am. We can start on my slides, if we can. So my name is Crystal. I work with NAS and Wellness Pharmacy. I also work at the Wellsprings Infusion Clinic. We can go to the next slide. Okay, perfect. So I graduated from CDI in 2022. And I started in 2020. So I started right in the heart of COVID. So I know what it was like to be completely online. And then by 2023, by 2021, 2022, we slowly transitioned back into in classes. So I will be talking from my experience going through the program, becoming an employer, how things have changed, and kind of what I'm looking for when we do hirings, when we have candidates that come to us, and just some tips and tricks on entering the workforce. Okay, we can go to the next one. So for in-person learning, we can go to the next slide. So these are some of the points that I have, and we'll quickly go through. I don't know how everybody learns, but I specifically am a hands-on type person. So a lot of times when we are learning theory and we're sitting in classrooms, we're going through textbooks, we're going through PowerPoint slides, we're getting examples, it doesn't really click to me until I can physically do it. So that's from day one till when we graduated. So a lot of the things that we learned, we got to test out in labs. Lab days were my personal favorite days because that's when I can actually do all the things I learned, ask questions. We had our instructors with us during the entire time at labs. So when we did run into any problems, we were always able to problem solve. We were able to figure things out really quick with the guidance of an instructor. And because like we've been saying, the classroom sizes are smaller, you have that connection with your teachers. So my instructors were really great. They were very supportive inside and outside of school hours. A lot of the times where I did struggle with something, if it was anything theory based, it was anything clinical, they had after our office hours for me to touch base with them on. And that's something that I really appreciated, because a lot of the times when you come from like a bigger school, you kind of get lost in the crowd. So there are times where you had questions and concerns, and there's a lineup outside of the instructor's office. And not only is there a lineup, sometimes it's a challenge communicating with your instructors, with their schedules, with their working hours. But that's not something that I really experienced with CDI. It was more of a communication was always available. It was always open. And especially with the lab options, we were able to really go through a lot of the step-by-steps. And I think with in-class learning, it was something that I really did appreciate, because not only were the instructors knowledgeable, they all have experience working in the field. So it's not that teachers have not worked as nurses and they kind of are going off of a textbook. They were genuinely able to give you examples of their personal experiences working in their personal jobs, working as nurses in hospitals, long-term cares, wound care, things like that. So that's something that I really did take with me when I graduated. So when I graduated, I was able to be like, oh yeah, I remember she said when she runs into experiences like this in the hospital, this is kind of how we problem solve. And I kind of built up on that. So yeah, those are kind of the advantages that I saw. And a lot of times we build community with our classmates as well. So it's not always about the instructor in the classrooms, it's about your cohort as well, because we're together for 18 months. So in 18 months, you build friendships, you build relationships, you build a good support system. We study together, we take tests together. Some of us cry together, some of us experience this program together, and it really does help build community. Not everybody graduates together, but that doesn't mean that we end ties there. A lot of the people stay in contact after we graduate. A lot of people will stay and see each other after classes, after we graduate, because it is a community. So we do have our teachers, we do have the classroom, but we also have our own cohort that really does help us. And that's not something that you really get when you're in a big crowded school, when you're in these big classrooms, auditoriums, When you're just another person in a classroom, you get this with a smaller group of people all focused and dedicated on the same goal. And usually the same goal here is to graduate and become an LPN, an RN, a carrier, whatever your goal is for that. All right, we can go to the next slide. Hands-on experience. And we can go on the next slide. So I did touch base on the hands-on experience part, but I just wanted to go over some of the other benefits of it. So a lot of times when there are in your mind, a lot of things will go through like, hey, I know how to change beds. I know how to change patients. I know how to do all these things. It's straightforward. It's very easy. It's not until you get into a situation where you actually have to put it to use, where you see complications. You're like, hey, I don't think this is going to work, or the patient's a lot heavier than I thought. How do we deal with this? Or the patient's very light, or the patient has mobility issues. The patient has anything where it can kind of throw a wrench into kind of what you had expected in your head. That's where the instructors step in, the practicum placements, the teachers, everybody kind of helps and be like, okay, let's problem solve together. One thing I did enjoy was instead of kind of giving you answers, we worked together as a team. So we all brainstormed together, we all problem solved together. And this is where community also comes into place. So this is where all of our classmates, we would get together, we're like, this is a problem, what is the solution? So it wasn't just there is a yes and no answer, there's a right and wrong answer. The school really gave me the opportunity to problem solve and kind of be creative with it. And yes, there are definitely rights and wrongs, and we do learn that in a lot of our classes. But when it comes to lab days, we were able to experiment, we were able to make mistakes, we were able to catch our mistakes, and then we were able to kind of move forward and figure out what would be the best course of actions. And not only that, we were able to ask questions and give hypothetical situations. So I was always that person who was like, what if? What if my patient does this? What if family members say this? What if this happens? And I always wanted to be that person who wanted to be prepared. Nothing will prepare you for the working force. I can tell you that now. But in school, I always wanted to be like, what if? And I wanted to get all the answers that I could. And when my instructors didn't really have the answer to give, they were able to talk amongst themselves. They were able to talk to their colleagues and come back to me with answers. So that also gave me the opportunity to kind of learn how they worked as a team and build off of that as well. So they work in collaboration, all the instructors, coworkers, to help teach us. So it's not just one teacher with one class. They all work together to kind of give you a well-balanced program. And that's something that I appreciated, because there are times where you connected with a teacher and you can go to that teacher with anything and everything. And so a lot of the times I was running to a teacher and I'm like, these are all my problems. Like, how can we fix them? And they're like, hey, let's take it step by step. And if they didn't have the answer right away, they would get back to me within however many days, if not the next day in class. So yeah, that's kind of how that works there. So these next couple slides are more about what we look for when we're applying for positions in a healthcare role. So to explain a little bit about my company, we hire support workers, carries, LPNs, and RNs. We have different roles for different job titles. And I have been a support worker. I've worked as a carried, and I have worked as an LPN. I did graduate in 2022, but I have about 6 to 7 years of healthcare experience. So I've seen it from different sides, different spectrums. I've kind of gone all over the place, working in group homes, working in long-term care facilities, working in retirement homes, working with high behavior individual in mental health, and now I'm working at a pharmacy. So there are definitely tips and tricks to interviews, tips and tricks for getting new jobs, new placements, and I'll just touch base on that for a little bit. Okay, So preparing for an interview. Know the company you're applying for, anticipate common questions, rehearse your responses. I can't tell you how many times I've gotten interviews have come my way and they have no idea what we do. So a little bit about our program is we are a program that goes house to house. So we send nurses, care aides to individuals' homes, and it is a community-based program. So we drive from one house to another house. And I've got applicants who don't have a driver's license, who aren't comfortable driving long distances, who just aren't familiar with the role in general. And they obviously don't get through. So it's really important for you, even if you're not familiar with the role or the company, to do a little bit of research, know what you're applying for, so that you know what kind of questions to expect, right? So we obviously, as employers, are asking questions based off of the role. So when I'm interviewing for the positions that I look for, I'm going to be asking questions relatively, how are you able to handle stress? This can be a stressful job. And I need to know that you have experience working in a stressful environment, working with difficult patients, working in Vancouver. You know, people get lost, things happen, there's traffic, there's construction, all those kind of things, right? And rehearse your responses. You won't always know what the questions are being asked, but you can still rehearse very common questions. Questions like, what are your strengths? What are your weaknesses? Those are two questions, even when I was interviewing for other roles, those are two common questions that I always got. And people were always like, these are my strengths. And everybody knew that off the top of their head. What are your weaknesses? I think those are those are the ones that people get stumped on pretty easily, being able to say, hey, these are my weaknesses. And people always ask, like, hey, can we skip this question? Or, like, people don't really have readily available answers for that. Other questions that are commonly asked are just your experiences, your ability to handle certain situations, stress levels. Those are really common questions that I feel like I've been asked at every single job I've applied for. And those are also questions that I ask when I am hiring from other places. And so what I look for when I do interviews is the ability to answer the questions. A lot of times, some people are not able to answer the question, or they hear my question and they give me an answer that's not even relevant to the question I asked. It's okay to take a second. If I ask you a question and you don't know the answer right off the top of your head, just take a moment. Just take a moment, think, and respond. We don't penalize for that or anything like that. I would just take a sip, like you can have water with you, take a sip, take a break, and answer the question. A lot of times people are so quick to answer the questions, like they don't really think it through, and it's not relevant to what I ask. Critical think is questions. So when I'm interviewing for positions, I will ask questions based on scenarios. So this is a scenario. You're working on a route, you come to a patient's home and they're unconscious. What would you do, right? Critically think, what are your main points that you're going to talk about, your concerns? We want to be very thorough with the scenario-based questions, because this is letting the employer know that in a situation like this, you're very prepared, or you're aware of the consequences, the risks, things like that, right? So again, take a moment, think it through, answer. Remain calm. I understand the jitters. I know people can get anxious, people can get frustrated. It's nerve-wracking going through interviews. It's nerve-wracking to be talking to a future employer, especially if it's an employer that you want. Whether it's our pharmacy, Fraser Health, Providence, anybody that you're wanting a job with, you're excited to be working for, you'll have jitters, you'll be anxious. But it's important for you to just remain calm, because the more anxious you get, you're not going to be able to critically think as well, right? Speak clearly, concisely, and show personality. I think some people are so focused on getting the right answer, the exact right combination of everything. They forget to show that they are they're different from everybody else, right? And your experience is what's going to make you stand out from the rest. Nobody else has experienced what you've experienced. Nobody else has done the same things you've done. We all have the same education. All of us have graduated similar programs, but your individuality is what's going to set you apart from the rest of the candidates, especially when you're applying for Fraser Health and one of the other authorities that have constant applications going through. Let them know that you're a different person and you have different skills that would benefit their company. Okay, you can go to the next one. So some people are so focused on the interview part, they forget that there's a whole experience afterwards when you get hired. So when people get hired, they think that that's it. That's the worst of it. They've gone through that. It's going to be easy breezy, which is not the case. So what happens is when you do get hired, I will pay extra attention to you. So now we've offered you the offer letter. You come in for orientation. We're having you put on the route and you're working with our coworkers, you're working with patients. This is where I'm going to be watching to make sure that you're picking up skills and tasks. So during the orientation, we're going to go over what you're going to expect, the skills you're needing. We're going to go through any learning tasks and any concerns that you have. And that's where I'm going to be paying attention to see who is able to pick up quickly and who is not able to really have the skills to be with our patients, right? That's all. This is also the time where we're looking how well are you communicating. Not only communicating if there's any issues, but communicating what's going well, answering phone calls, emails, communicating openly with us, because during that first initial page, there is going to be a lot of communication because we want to make sure everything's going smoothly. So if you're hired and you're working and you're no longer answering phone calls, you're no longer answering emails, you're no longer communicating, that is kind of a red flag for an employer. Like it's going to be difficult for us to keep track of this patient, of this person. We're not able to openly communicate. Like it's very important for us to know that you're able to communicate well with our pharmacy, with our coworkers, your other nurses, care aides, things like that. So not only is it responding back to head office, your supervisor, your managers, but it's also how well you're communicating with other people. How well are you able to take on criticism? Because again, you're newly hired. So there is going to be a learning curve with new people who come on board. There's a learning curve because now you're adapting to the way their system is set up. So no matter how many years of experience, you could have 30 years of experience. When you get hired with a new company, there are learning curves. And that is where we take criticism, we take education, we take any constructiveness that comes through and we implement it, right? That's part of the communication that goes with it. How well you interact with the patients. With this role, being a care aide, support worker, LPN, RN, the patients are the priority. The patients are the reason why we are in the role that we are. We want to make sure that we're meeting their needs and we're advocating for our patients. Whether you're new or you've been with the company forever, advocating for patients, letting our supervisors, care team know, hey, this is what's happening, knowing what's well. If the patients are improving and getting stronger, better, anything like that, letting our team know. If they're deteriorating, letting our team know. But it's the fact that we're paying attention to our patients and how they're doing overall. And then how well you collaborate and work with your coworkers and interdisciplinary teams. So that includes doctors, case managers, family members, just the team in general. And again, a lot of times you're coming into an already established system. So there's already an established protocols, policies, way of doing the tasks and the role. And that's what I'm also looking for, is if you can mesh well with the team. You could be a great nurse. You could be a great nurse, but if there are issues and it's causing a lot of conflict with the rest of the team, then those are things that would come up as a red flag of, I don't know if this person would be the best fit for our program if it's causing a disruption to the team in general. Okay, we can go to the next one. So just some final tips and takeaways. We work together in colleges to build understanding, develop skills for your future. So what that just generally means is we are looking to develop skills because these are the skills that you're going to be using when you get employed. I think some people forget that when you're going to college, you're not going to college just to pass. You're not going to college just to graduate. You're going to college to learn the skills you're going to need for your future employers. So these are the skills that I look for. So when you come in to a new organization, we're looking to see, do you actually understand the skills that you've learned? So some people can memorize textbooks, some people can memorize how the steps to doing certain things. But if you're not genuinely understanding the concept of it, then that shows in your work, right? We encourage growth and create a safe environment to learn, which they really do. CDI really does encourage growth and learning because a lot of the graduates do get hired afterwards. So I have gone to CDI events and I have done on the spot interviews and I've given out a few offer letters now from these events because I do trust in the way CDI runs their operations, the way they educate their nurses and care aides, and they really do try to make sure that the nurses and care aides understand how to do the work, how to do the skills, and they're not just memorized. And that's coming from a graduate. So even when I was in the program, CDI made sure that I understood why I do the things I do, why we have the skills, and how to go about taking care of patients. So, and the hands-on learning helps students master their skills, which I really do agree. I agree that it helps cater to different types of students. If you are somebody who learns best with textbooks, if you're somebody who learns best with the theory based, they give you that option and they give you the opportunity to test out what you've learned. So that's kind of how we have learned with CDI in the past, and that's how they've continued to create their program where they cater to different learning styles. I think in some universities and some schools, it's very focused on theory and textbook, and my experience with CDI is where we kind of all come together. There's different learning styles. We all have our needs met, and if your needs aren't met, they'll come with a solution. They'll come up with something to meet you in the middle. And then we've gone over the interview process. We've kind of gone over some of the tips and tricks on what it is to do an interview, and even after interviews, kind of what we look for. So that's kind of my experience as an employer and as a graduate of CDI, and I'm more than happy to answer any questions or any concerns after the presentation. And this is my contact information. If you ever want to reach out to me, you can call our head office or you can email me directly.
Thank you so much, Crystal. And again, thank you so much for giving all the insight of the program and hiring and every little details. Now we'll have a floor open for anybody who have any questions. I see there's one question here that is for starting pay rate. So I would say like Crystal or Faye, any of you can answer that question. I want to ask what is the starting pay rate for practical nursing? Sukhveer is asking that question. Faye?
I think the starting pay rate now is about $28 and it can go up to 33 to 35. It depends on which province you work in. I saw that there's some being paid at 40 in Courtney, BC, and then Kelowna is paying like 39. And the travel nurses, I think, are getting paid more, close to $50, if you're willing to be a travel nurse.
And just to add on to Faye, it also comes with your experience. So, like for me, for instance, I am a new graduate, relatively new to the LPN program, but I've had so many years of experience with working as a care aide, working as a support worker, being in healthcare. So always negotiate. So I know a lot of people will go into situations, as long as it's not in a pay grid. The pay grid is everybody's starts at the same level and you work up depending on your hours. But if they do give the option to negotiate, I would always negotiate. Know your skills, know your experience, know what you bring to the company, and negotiate your price, right? So when my company does not have a pay grid, so we do negotiations with our nurses and our care aides, because everybody has different experiences and we can always put them in different places as well. So don't be afraid to negotiate. Don't be afraid to come in, ask for a higher rate than you're expecting and work your way down within reason. So if the rate is anywhere between 28 and 30 something, start on the high side and you can work your way down. Know your value as well, right? So those are just some of the things I wanted to add.
Great, thank you. And Lucky, I believe you have a question that you're a registered nurse in Philippines and you came to Canada on a pilot closed work permit. Unfortunately, when you're on a closed work permit, you cannot start any program. Doesn't matter whether it's online, in person, when you're on closed. So once you're PR, then yeah, definitely you can look into the program. And who else is there? Sukrit again. If I want to do a RN after this practical nurse, how long it will take to complete the RN? Okay.
So I'll answer that. It depends on where you go to. You'll have a complete assessment. I know BCC community does have BCIT. I think there's a fast track at BCIT. I think it's 2.5 years. And there's also Douglas. But some of your courses that you've taken from LPN will be credited.
Okay. Anybody else have any questions? I don't see anybody else. Okay, Sarah, to be able to register in LPN program, you have to pass IELTS English academic exam as well as anatomy and other subjects. Where the students have to take those exams or biology, anatomy, etc. in this college. So Sarah, as for the IELTS, it depends where your education is from. So the IELTS, the students who have to take IELTS is if their education is from non-English speaking country. If you have 3 years of face-to-face full-time education from English speaking country, then you don't need IELTS. And as for the other courses like anatomy and physiology, English, math, bio, those you can upgrade. You can take those courses with us and it is online. So you have my contact number. You can always call me and I can go over all the details again. Okay. Any other question, anybody? Okay. What are the intakes available? So the intakes, the intakes is we offer 4 times a year. So right now we're accepting application for September, January, and April, and September again next year. So this year is only September, then next year January, April, and September. As to the requirement, if you can contact me, the number I can go over, but I have to look at your transcript. So, but the requirement is if you don't have 3 years of education from English speaking country, you need IELTS, and beside IELTS, we need English 12, Math 11, Bio 12, and Human Anatomy and Physiology. So those are the courses along with interview with our PN coordinator and clean criminal record check. But please contact me, then I can go in details, all the information, or you can come and see me at Surrey campus. Okay. Does that answer your question, Sukri? Okay, I would. This is our contact information. You guys connect with us, cdicollege.ca. But I have mentioned if you can call me or email me directly as well. I have put it on the chat, and I'll be happy to answer and help you all, everybody, if you have any question or concern, anything. Okay. Great. Thank you so much for attending our open house here. But please feel free to call us anytime, or you can come and visit us at our campus. Okay. Thank you.